Good morning. I'm Dr. Kaushal, Ippili, consultant neurosurgeon at Apollo Health City, Jubilee Hills. Today I'm going to talk about a very basic thing which is called as deep gluteal pain. So you might have many people use the word sciatica for any kind of leg pain that you're having. You call it, okay, I have a sciatic pain. But then it has many implications. Most of the people think that it is because of the spine problem. But it may not be just because of the spine problem. Many times we notice that patient complains of leg pain, they come saying that I have sciatica, but then obviously they come with MRIs of the spine and all, which are nearly normal. Majority of these patients do complain of something called as deep gluteal pain, means they have some pain in the buttock which is going down to the leg. So it is not always the spine problem that is causing this kind of pain. So you have something called, there are a lot of muscles in the buttock region, and these muscles are in vicinity of the sciatic nerve which is supplying the leg. So the problem associated with these muscles or the hip joint can also cause something called as this kind of radiating pain down to your leg. So what I want to educate you is that if somebody is having a pain in the leg, it is not always a spine related problem. You need to visit a neurosurgeon where we will evaluate whether it is a spine problem or pain related to the gluteal region. So in this, what we do is we do a lot of clinical tests which tell us whether it is spine or the gluteal thing. In the buttock region, the muscles, something called as piriformis syndrome, which is very common in these patients who come with deep gluteal pain, can be evaluated clinically, and also radiologically also we can evaluate by doing something called as MRI Neurography, which is a special test which actually traces the sciatic nerve from its origin down to the supply. It will tell us whether the sciatic nerve is getting pinched near the muscle area or near the hip region, or something called as the pelvic, means that is called the ischial tuberosity on which we sit. So most of these patients, that's why complain of pain that is going down to the leg when they are in sitting position rather than bending or walking. They feel better when they are walking. So what I want to tell you in this short talk is that not all leg pains are because of spine problems. There are extraspinal causes, and we see many patients who are wrongly diagnosed with spine problem, and then they undergo some injections in the spine. They come up with a lot of MRIs saying that I have a disc disease and all. So what I want to stress is that this is a different entity which is called as deep gluteal pain, where the patient have similar kind of pain radiating from the hip region or the buttock region going to the leg, and we need evaluation both clinically as well as radiologically with these special tests. Then this problem can be tackled easily by giving some sort of injection to the muscle, particular muscle, with some guidance which can be done as an ultrasound guidance scan or a Doppler scan we will do, and with that guidance we can give injection. And if it is still refractory, we treat them with a minor surgical procedure where we actually release the nerve from the muscle which is impinging it. Thank you.